discussion as they come along?
Yeah, just give me 1 second. I'm actually bringing up the PowerPoint now. So let me just be able to switch here and share.
This topic was specifically requested by some because of, all the changes to your body as you're going through treatment and beyond, and really what can we do to bring the topic up and have an open discussion on it. And this will be recorded and made available on demand so that if folks couldn't join tonight live, they can always view it later. So that'll be a really good opportunity for others. So I welcome you, Amanda and Nicole, for joining us, and thank you very much for taking this time to be with us. Please go ahead and introduce yourselves.
Well, thank you for having us very much. We're grateful to be here, and I think this is a great topic for the new year. So my name is Nicole Reilley Dosey. I work for Allegheny Health Network Therapy Services. I'm in charge of oncology, rehab, pelvic health therapy services, and lymphedema. And today I'm going to obviously talk about exercise and a relationship a little bit to oncology rehab, but specifically more with exercise and getting back to exercise or starting exercise for the first time. And I'll let Amanda introduce herself as well too.
Thank you, Nicole. My name is Amanda Capor, and I'm a dietitian at Allegheny Health Network. I work in our outpatient oncology clinics through our Cancer Institute, and I'm typically at our West Penn Mellon Pavilion location. I also cover our Robinson office as well, and I work with patients, throughout the treatment process.
Thanks, Amanda. So we kind of split this into two parts for everybody. So I'm going to start off with some exercise-based stuff, and then Amanda's going to come in with the nutrition component, but we kind of follow the same pattern, both of us. So I'll just get started here, move on to this next slide here. So I apologize. Let me rearrange my view here because all of a sudden I couldn't see some of my own slides. So this is just a general disclaimer here. Everything that Amanda and I are going to share is obviously, professionally driven, but isn't supposed to take the place of a healthcare provider. So anything that we discuss here, we still would like you to talk to your healthcare provider. So I think that a couple of things that when we were talking about this would be a great topic to discuss. A couple of things that came to mind for me were, obviously, what are the benefits of exercise in general, and also related to when you're going through some type of oncologic care. Should I exercise during cancer treatment and recovery? And can regular exercise improve cancer survivors? So those are the couple hot topics I'm going to hit today, along with some guidance and some pointers on how to return to exercise or how to start an exercise program. I want to keep this pretty informal. At a couple points, I'll stop and see if anybody has any questions or specifically wants me to expand upon some things. So don't be afraid to jump in there. So I chose to put this up first because I think this is very important. So when we talk about can exercise help survival, can exercise prevent cancer? So there's a lot of new research out there. So this was just posted within the last couple years that there's 7 cancers that they looked at in particularly: colon, bladder, breast, endometrial, kidney, esophageal, and stomach. And a lot of the new research shows out there based on some of the types of exercise research and protocols that are out there that it can actually prevent cancer 10 to 20% in these particular cancers. So I think that's pretty profound that we're starting to see that exercise, that the research is out there showing not only is exercise good for you, we all know that exercise is good for you, but specifically, why is it good in this case? And I'll expand upon this a little bit later and explain why there's some correlation between exercising and cancer. The other statistic I thought was interesting is post-diagnosis. So for somebody that has already been diagnosed with breast cancer, colon cancer, prostate cancer, a lot of the research out there is showing 31 to 50% reduced risk of cancer mortality, which I think that's a very large number. And I think there's so much research to be done on this, but I thought this statistic was very interesting and probably pretty profound. So this is one of my favorite slides. I always say because I am a therapy geek, so that's why this is my favorite slide is. So I want to use this term rehab very, very loosely. In this section here, you'll see there's a green arrow that follows this through. I don't know if you guys can see my pointer on here, but there's a green arrow that kind of follows this through. And this would be considered the rehab arrow. Then there's this red one that kind of follows down here. So when I say the word with and without rehab, in my mind, it's with and without exercise. So what this is showing in a nutshell is this, is at diagnosis. So I'm my everyday person walking around, and I may have other underlying comorbidities or other, and I hate to use medical terms, I'm sorry, other underlying conditions. At the time of diagnosis, so unfortunately, when I get my cancer diagnosis, if I'm exercising or I start an exercise program, and then I carry that through, which is ideal what we want for patients. If we carry this through, say we're having surgery. In this case, it gives an example of surgery instead of what we consider neoadjuvant therapy, which sometimes people get chemo before that. In this scenario, it's showing surgery and then treatment afterwards, and then living with and beyond cancer. So you could see with this trajectory here is, yes, there's a dip a little bit in treatment, right? So if this is my baseline here, there's a dip in treatment during treatment time, but then my functional abilities, that's what this arrow is depicting, really comes back up to my very peak above baseline if I'm keeping up with exercise during my treatment, as opposed to the person who may be here baseline, may or may not exercise. And so as they deal with their diagnosis, as they go through surgery, as they go through continued treatment, this trajectory kind of goes in a downward slope. Because all of this, and as many of you know who have been through cancer treatment, really play a tough time on the body, your condition, your ability to do stuff, your function. So there is a significant decline in those people that aren't active or aren't doing some type of exercise. So again, why this is one of my favorite slides is I think it's so supportive of why, again, exercises could be very beneficial. So I wanted to look at exercise across the whole entire spectrum. So I broke this down in a couple of different regions because I thought that this was the easiest way to look at it is. So when I talked about diagnosis, right, and then during treatment, regardless if that's radiation, chemo, surgery, immunotherapy, whatever type of treatment at that point you're receiving, and then into what we'll say survivorship or living with cancer. So we have this prehab stage where you're starting a program or you're doing exercises or continuing exercises at the very time of diagnosis before you start any treatment. So as we've looked at things here, and I say this, some of this comes from research, but a lot of this also comes from, I say, practice in itself, meaning that patient care actually itself, not just what we show in research, but what are actually we're seeing in our patients today. So at time of diagnosis, a lot of people have underlying pain, right? We have arthritis, we may have a bad shoulder, we may have some bursitis going on, but exercise helps decrease pain. The overall goal of this, so starting this exercise program, kind of what I alluded to on the other side, was to reduce any time in the hospital, to improve your overall outcomes or your ability to withstand treatment, to decrease the effects of cancer itself and how sometimes it makes people feel very debilitated. The other bonus of exercise is we know that exercise helps improve endorphins, which can also help with anxiety and depression. I have a lot of friends who go out there and exercise, and yes, cardiac is a very good reason, but a lot of them, for them, it's a stress management. And then obviously for the physical reasons of increasing strength and muscle mass. And I'll explain later why increasing muscle mass for cancer patients is a very significant thing. So then we move into exercise during treatment time. So you could see there are so many things here that are beneficial for exercise while you're going through treatments. And I'm not going to go into every single one of these because I always say, I know everybody can read this slide, so I'm not going to insult anybody's intelligence here. But I think a couple of the things to point out that we don't think of is fatigue. So the statistic here, if you look at it, at many different research articles, just patient reports, like general patient outcomes and report, at some point along cancer treatment, the average patient reports 90% of the time that they have cancer-related fatigue. I think that number is so, like, it just blows my mind every time I say it when I'm doing one of these talks, that 90% of people during cancer care report fatigue. So what do we know? One of the best things for fatigue is movement and exercise. And I know it's always so hard for people to get started. And that's where I'm hopefully here to share some things with you today, is those little things that you can do to kind of try to, not let that fatigue kind of take over or feel like you've got to rest too much. So exercise for fatigue is extremely important. The other thing that some people have questions about is, like, say they've had breast surgery, or say they've had some gynecological surgery that maybe they're getting swelling in their legs, or like I said, from breasts and their arms. Exercise is really good for lymphedema too. The lymphatic system does not have its own pumping system. So it relies on the muscle and the ability to move to pump the system. And what happens when you have lymphedema or that swelling is that lymphatic system backing up. So we want to keep that lymphatic system moving. The other couple aspects here I want to hit on is bone health. So as many of you are aware, if you've been diagnosed with breast cancer or have a family member dealing with breast cancer, prostate cancer, ovarian cancer, is those cancers, one of the ways that they're treated is through hormone deprivation, or like for women for breast cancer, we'll use estrogen deprivation. By decreasing that estrogen, it also has effect on our bone health. So a lot of these women, or men in this case, are at high risk for osteoporosis. Again, we know that weight-bearing exercises and loading up the bone helps build up bone health and decreases the likelihood of further progression of the disease or a fracture. The last thing I wanted to hit on here was what I have written here is CIPN, which is chemo-induced peripheral neuropathy. Many patients that go through chemo, large majority of them report they're having that numbness and tingling in their hands and their feet. So I always tell people, for therapy services or for exercise, we can't cure that. Do you know what I mean? We're not going to make it in the sense of that we know that chemo does induce it, but the tolerance to it can be better with exercise. So the ability to weight bear through the feet, there's certain modalities that you could use. And sometimes if you've ever seen kinesio taping, so some of the sports athletes wear the taping on them, some of the kinesio taping on the feet can help with that sensory component. So things that are very beneficial for exercise over that spectrum of cancer treatment. Then we get into exercise into survivorship. So again, I just put this statistic here. I'm one of these ones that always like numbers because I think they speak a lot of words with just a number itself. So we see here that secondary prevention, that 31 to 50% reduced risk of cancer mortality in breast, colon, and prostate cancer. I just think that says so much. Along with that, is just the benefits we do know of exercise, right? Improving cardiac function. Weight seems to be an issue for a lot of patients as they've gone through cancer care, like I said, and if their hormones have been depleted, and some women are going into menopause, they really fight that component of weight. Of course, exercise is going to increase strength, and we've talked about fatigue and anxiety and depression here, and overall just improve quality of life. It could be very beneficial for helping you sleep. I tell people the more you move, the more you feel like at the end of the day, you're ready to get that 8 hours of sleep. Does anybody have any questions so far? Okay. So here's the big questions, right? These are the ones that I think come up a lot, is how does physical activity or exercise reduce cancer risk? So I will tell you that there has been a lot of, and I'm sorry I'm using the word new research out there, but I would say that oncology, rehab, and exercise is becoming such a newer topic or a newer thing that you hear about, that now we're starting to get more of the research out there supporting it. And so basically, to bring this down to like maybe the easiest level possible, is that it helps, exercise obviously helps decrease fat tissue. And why that's so important is, again, because of hormones. So if we can, fat excretes hormones. So if we can decrease the fat, we can decrease the hormones and inflammation, which inflammation is another thing in obesity, obviously, that put a person high risk for cancer. It also improves the immune system and the digestive system. So if you're talking about systems itself, we're talking about reducing that fat so it doesn't decrease, so it doesn't produce excessive hormones, and trying to improve our overall immune system and digestive systems. Gut health is one of these, I'm sure if some of you have looked into things, probiotics and gut health become, another very hot topic this day. So the other thing I know that the question is, okay, when is the optimal time? What is the intensity? What is the duration? What is the frequency? What is it that I should do? So again, this is an opportunity. I'm sorry I say again a lot, but I do want to stress certain things. I'm here to give you some tips on to get started. I really encourage anybody who wants to start an exercise program, or unfortunately has been through some type of cancer care, to really reach out to a healthcare professional. And I have some resources here at the end of the slides here to really get that. I can't say enough that any type of exercise, no matter if you have any type of diagnosis or you're a fairly healthy individual, I really do think it should be very individualized, just not a blank ticket that this works, one thing works good for everybody. And last thing on here is the sedentary behavior associated with increased risk for cancer. Well, obviously, some of the things I've already said have kind of pointed that out, that, obesity, extra weight, hormones, can lead to that is associated a lot with a sedentary lifestyle and put a higher risk for cancer. So what are the myths we have here? So as I was doing this is one of the things that kind of made me chuckle, because some of us fit into this category and some of us fit into that category. And, so many of us want to get in that middle category, but we're not quite there. And I got to put myself in this category. So a lot of the belief is, I have this here, is if I am active throughout the day, like I don't lead a sedentary lifestyle. I'm a PT, so I'm on my feet, I'm moving, I'm doing this, like I don't need to exercise. Myth, untrue. Our activity level, what our body's used to is our certain activity level, and us exercising are two different things. Vice versa, this is where I laugh at myself, is I work out, I like to be I like to exercise and be active, and I do that, but I'm also in a job that a lot of days I'm in front of the computer or I'm doing something like this, and then I kind of lead that sedentary lifestyle. No, I'm not getting up out of my chair, I'm not moving. So we need to have the mesh of those perfect worlds, is we're moving throughout the day and we're doing some type of activity, exercise afterwards. The other thing I think that we're famous for saying in the healthcare, or if it's your family member, you say, oh, well, I know you're tired, just rest, conserve your energy. You have a lot going on. That is all true. There is a lot going on in the body. But I think we need to stay away from the constant telling the person to rest, because what we know is the more you rest, the worse you feel. The more you do, even if it's in little increments, the better you feel overall. And then the last thing is that all or nothing approach. We're all like this in some way. It's either food or it's chocolate or it's exercise so I really want to encourage people. You're going to have those good days and bad days. Everybody is, no matter what kind of disease process or illness that you have going on, or just in general in life. Life is kind of that way. Some days, some days we have this great day. Some days we have this bad day. Don't take the bad days and make them continuous bad days. Or, I had cake today, so I'm not going to exercise because I had cake anyways, so I just won't exercise. I tell people, no, eat the cake and then go exercise. You know what I mean? Is don't make every bad day a complete wash. And the days that you feel good, maybe try to do a little extra. And the days that you do feel bad, because maybe there are days you really feel bad, it's okay to rest those days. But I always tell people, let's not make every day just a complete blank slate. Like, I had a bad day, so I'm not doing anything, because we're all guilty of that. So what are the recommendations? So in 2018, I thought this was great. The American College of Sports Medicine and the American Cancer Society, and also I forgot to add this on here, the Canadian Cancer Society kind of came together and they came with the same standards. So it's 150 minutes to 300 minutes of exercise 3 to 5 times a week. So that's basically, when you break that down, I tell my patients, I want you trying to do 30 minutes of aerobic exercise, either 3 times a day or 3 times a day. Yeah. 3 times a week. Yeah. None of us have that time. 3 times a week to 5 times a week is the very ideal. Strength training or resistance training, the goal is at a minimum 2 times a week. And so when we talk about, when I said this, what is that intensity? We want to have moderate intensity, meaning I'm working hard, I'm sweating, but I can still talk to you. It's not so bad that I have to keep gasping for air. So that's the type of intensity. And I'm going to give you some examples here. So when we talk about low intensity, we talk about your Tai Chi, your yogas, maybe some of your yoga meditation, where it's really, really good. We've seen a lot of benefit for fatigue, anxiety, sleep deprivation, which you're more trying to center yourself in that low intensity exercise. Now, if we're talking about the type of exercise, like we said, that we want to make gains for fatigue and neuropathy and deconditioning and debility, we're talking about that moderate intensity. So the example I like to tell people is that brisk walk that you're going 3 to 4 miles an hour. If you have a treadmill, that's great because you could set it. Your bike, 8 to 10 miles an hour, swimming, tennis, baseball, volleyball, some of those active sports, kayaking, canoeing. So how do I start this if I feel so very fatigued? Because I'm in the healthcare profession, so I've heard this, like, I just don't have the energy to do it. And I get that, I understand that. So I tell everybody, try to start small, those 2 to 3 minutes every hour. So I have a patient right now, for example, who's having some significant neoadjuvant care, and she's getting ready to go in for surgery. And I explained that to her. I said, how much are you sitting at home? Can you get up every hour and walk 2 to 3 minutes? Can you start with 1 to 2 minutes, then 2 to 3 minutes, and just every hour? If that's walking around your house, everybody has to get up and go to the bathroom. Everybody has to go in the kitchen to get something to eat. If you can force yourself to do just that little bit, and try to make gains on that until you're building up to, say, a 10-minute clip. I do want to reiterate here what I said before is, we're trying to build up to that 30 minutes, but what we have found is doing 10 minutes in the morning, doing 10 minutes later in the day, doing 10 minutes in the evening can be just as beneficial, that cumulative 30 minutes, as of just doing that 30 minutes together. Again, like I said, doing something every day. Now, for the person that really feels really, really deconditioned and just has been through a lot, I have patients that are also 90 years old. There's some things I'm not going to ask them to try to do. So I found this recently, as many people are probably familiar with, Memorial Sloan Kettering Cancer Center is, a world-renowned cancer center, on their website here, and I can share it later so that basically you can share it with everybody, is a website, and it's literally patient education and chair exercise. So it's always the joke, I always say, the sit and be fit. Do you know what I mean? Is there's little exercise that take you through if you're a person that truly has mobility issues. So there's a play to start, even if you can't get up and move. And so how do I know what I'm doing? Like, how do I know I'm doing enough, or how do I gauge things, or, how do I know when I'm overdoing it? I think some very simple signs are this. If it hurts too much, meaning not my muscles are short, like I'm literally hurting myself, stop. Use pain as your guide. If you're dizzy, you're getting swelling or short of breath, I would also say that that's a sign, maybe that not you're doing something bad, but you're doing too much. One of my favorite little gadgets is the pulse ox here. These are fairly cheap. You can buy them off of Amazon. I think they run from like about $12 to $40. This one I think was like a $15 one that my husband and I have at home. Neat little gadget, because if I just clip it on my finger and turn it on, it tells me what my resting heart rate is and what my resting oxygen rate is, which is extremely important when we're talking about dizziness and shortness of breath. Dizziness can be caused, maybe your blood pressure is a little bit low, and not everybody has a blood pressure cuff at home, but you could see, is my heart rate fluctuating too much? Is my oxygen off? So just to give you some guidelines, most people's oxygen run between about 96, 97, and 100. We always tell people if it drops below that, like 95, 94 when you're exercising, you may want to stop and take a couple of deep breaths. Maybe you're just not getting enough oxygen, or maybe it's a little bit too much for you. The other thing on here, like I said, is your heart rate. So if you're super physically fit, I have friends that their heart rate is 45 at rest, not mine, but my friends that are super aerobic and their heart rate's 45 at rest, or some medications do make your heart rate lower. You have an idea of what your baseline is. There are people that run average about 100, and certain medications or lack of exercise could be that. But if you see those increases, that you could start to gauge, well, what is too much? Is my heart rate 180? Well, that's probably a little too much. So this little gadget is very helpful. I'm at 99 right now, and I think because I'm talking, I'm at 95 for my heart rate. So good to know that my things are pumping and going here. The other thing is this nice little scale here I love. This perceived exertion scale is, so we talked about moderate exercise, right? We want to be in that 4 to 5 range where I can go a little bit longer, I can keep doing it, but I can hold a conversation, or short bouts of conversation. The 10 up here, I tell people, is probably too much. That's the feeling like you're going to pass out. I can't complete this anymore. I'm so short of breath. I can't talk to you. This doesn't feel good. I want to stop. This is probably not the area that you want to be in. 10. That 4 to 5 range is perfect place to be. Any other questions so far? Okay, so I borrowed this from a couple little websites. I thought that this was a really nice graph that kind of just broke it down as how do you get started again? And this is aerobic exercises, maybe 3 times a week for that first week and that second week, then building up to 4 times a week, 5 times a week, and talking about starting at that 15-minute clip and building to that 30. So again, not that all or nothing philosophy of start out slow, start doing something, and it'll become easier and easier and easier as you do it. Another example here is just an example program. It talks about, you're staying at that moderate activity level. As you can see what 30 minutes of exercise may look like, aerobic dance, a fast walk, a bike ride, some of those things that we talked about, a light volleyball, I say a light volleyball, a volleyball game that's not, super intense, but then it also gives you the calorie count here. I see that this says 165. In my experience, it's about 150s to 200 as the calories you burn, which again is not as important as the calories you burn as the fact that you're working your muscles. So resistance and strength training. So if we switch gears a little bit, I think this is the hardest one to share with a group collectively. The reason it's so difficult is because everybody can tolerate something different resistant than strength training. And this is where going to a healthcare professional, someone that's in therapy, someone that deals with oncology exercise is super beneficial. The overall goal here, if I look at, cancer-related exercise, is about 8 to 10 exercises, doing 2 to 3 times a week for 8 to 12 reps. So I know that's a huge, huge range. A lot of the newer research out there was, there's a lot out there about different circuit training and, high weights, low weights, high reps. There's so much out there. But what we found specifically related to cancer care is being able to do higher rates and multiple reps actually helps load that bone. So we talked about that for those patients that are having some issue with bone loss and osteoporosis, and increase body muscle mass. And again, the increase in body muscle mass goes back to, we're trying to minimize the fat because of fat hormone producing and increase body mass. The other reason body mass is so important is statistically we see as patients go through cancer care, there's 2 things that they're going on. One, none of us are getting younger. So as we get older, we lose muscle mass. And unfortunately, going through cancer treatment, because of some of the treatments of self, we lose muscle mass. So this is why resistance training is extremely important for our patient going through cancer care. How I broke this up is what we also have learned is those use the word proximal, but the joints that are closest to your body. So the shoulders, the hips, the actual core area, those are the muscles that seem to get the weakest, the easiest. So I always tell people, try to do some stuff in the upper body, try to do stuff in the lower body into the hips, and also some core exercises. So I like this little schematic here. It basically just gives a breakdown, and this is another thing I'm going to share that I actually have an individual sheet of that you guys can share. Is it breaks it down, like, are you trying to do exercise because you feel fatigued, or is it for anxiety, or is it for just to improve your quality of life? So it gives a little breakdown here of, 3 times a week for 30 minutes, or, what intensity. As you can see, most of the aerobic recommendation, exactly what we talked about. Several times a week, moderate intensity. Same thing for resistive and strengthening, 2 to 3 times a week. And you can see the reps that change here anywhere between 8 and 15. What I also like about this is it does say, where it doesn't have significant evidence to back it up, it doesn't put anything in there. So you could see under anxiety that aerobic exercise, again, because we're encouraging that endorphin rush that you get from aerobic activity, where not sufficient evidence has come out to say that resistive exercises, if you're trying to help treat your anxiety, shows that much benefit. Doesn't mean that it doesn't, just there isn't a lot of evidence out there yet. The last part of this is always like to leave people with resources. I think that's extremely important. We're doing a general overview here. So one of the things, actually have this book myself. It's called Moving Through Cancer. It's written by Catherine Schmitz. She is an she's an oncology exercise specialist. She is not a PT. I believe she has her PhD. But she wrote this book. It is recently been, it hasn't been out that long. I want to say within the last year or so. What I love about this book is it is kind of a recipe book for patients that are trying to return to exercise, dealing with the treatments and side effects of cancer. And so she goes through this. I also like about this her partner was diagnosed with head and neck cancer. So not only is she an oncology exercise specialist, but it hit very close to home to her. And she talks about her experiences of helping her significant other. So this is a great book. And I have the resource on here. The other 2 resources there's called the Maple Tree Cancer Alliance. If you click onto that hyperlink there's a lot of information about different programs. They have one set up in the area, some things that they have available online, so it's a great resource. The last one here is colinchamp.com. Dr. Colin Champ is new to the Allegheny Health Network. He leads our oncology exercise program. He has a website. He is very dedicated to, when Amanda and I started this, irony of it, he's very dedicated to both the nutrition component and the exercise component. His background is he's a radiation oncologist that has devoted his time to nutrition and exercise for the patient going through cancer care. So there's a lot of resources on there. So to sum this all up, the last couple of things I'd like to say is, I've used the word refer to your healthcare professional. But I do want people to know, regardless of what, institute or healthcare system that you're working with, please feel free to reach out to them, see if they have an oncology rehab team. Some of them also have oncology exercise programs. These could be very beneficial for starting a program or returning to exercise, and really do that individualized prescription of exercise as opposed to just trying to generalize it. The other components, obviously, that go along with what we're talking about today is, we could pull in the whole sleep component, but Amanda's going to talk about nutrition here as well. So I am done with my portion of it. And if anybody has any questions, please feel free to ask them. Or if you have something later, I'd be glad to provide my email as well.
Nicole, a quick question. I know the framework is rather general, but would you kind of say the same thing regardless of age? I mean, I understand somebody in their 90s, as you referenced, but if you have a pediatric cancer patient or somebody in their 20s versus somebody in their 50s, 60s, would you look at this a little bit different as far as maybe those minutes being a little bit more, or I am just in
Yeah,
general?
so you're right. So I have to be honest, I haven't treated a lot of pediatric cases. So I don't specifically want to say pediatric wise, but in saying that, I feel like if a person is in, past puberty, I mean, almost in the healthcare field, we say past puberty, we could fit that category of adulthood, right? That we're treating a person similar to adults. So I would say that, yes, I really feel like it doesn't matter if the person is 15 or the person is 80. I think really what we got to look at is what are the other underlying conditions, right? Have they been active before? How active do they, you know what I mean? How motivated and active do they want to be? So I think that the recommendations from the American Cancer Society and the American Sports Medicine are great recommendations of exercise, because it's funny, they pretty much parallel like recommendations for exercise in general. So I feel like it's a really good guideline to go by, because basically what they're saying is if you have cancer or if you don't have cancer, we really would like you to exercise 150 to 300 minutes of aerobic exercise a week. So I think that can be said very universally. Where like you said, we get into specifics, I think are, I have a patient who has, both knee arthritis, like we're going to modify things for that. But yeah, I think overall that resistive 2 to 3 times a week and exercise 150 to 300 is a very accurate thing you could say. It's just how to get there, I think, is what people struggle with, is that time frame of how long it takes. And that's why I tell people, I don't think it matters how long it takes. That's what I want to tell somebody is if you have to start here to build up to there, so be it. As of the person that you're right, might be 20 years old, that, 20 minutes off the clip right from the beginning, it is not that hard for that person. So yeah, I hope that helps.
Yes, yes. Lori, did you have a question? I wasn't sure if your hand was up or. Okay, sorry.
Well, thank you. Well, then I'm going to let Amanda take over here. Amanda, do you want me to stop sharing? Like how?
That would be great if you, and then I can take over the share.
Yeah. Okay, go ahead.
Let me. Sorry for the delay here. I'm just figuring out I have to pull up the presentation on my end.
That's what happened to me, so don't worry. I was like, oh, I think I got to pull up the presentation.
That would help. Here we
Right.
go. All right. Okay. Can everyone see my screen here? Okay, great. Let me just organize this here. All right, so thank you, Nicole, for that wonderful presentation on the physical activity component. And now I'm going to talk about the nutrition component as it relates to oncology. And it's really nice because you'll see a lot of these common themes and common denominators here as we talk about recommendations. So a few questions that I wanted to pose to the group for us to think about as we move through the discussion this evening are: what are potential nutrition concerns that come up throughout the cancer journey? And how can nutrition help to improve our patient outcomes? And the question that also comes up, how and when can I start making some of these beneficial nutrition changes? So when we talk about nutrition across the oncology journey, we do want to start with that pre-diagnosis, or the time before we start to see the patients coming into our clinics. You'll notice that a lot of these nutrition concerns do also flow over into prevention of recurrence as well as into survivorship. So you'll notice a lot of these same themes as we talk about the survivorship piece. But oftentimes when we have patients, coming in, there are concerns that we see, such as a loss of muscle mass that could be on its own or paired with excess body weight or excess body fat. And Nicole outlined, reasons why this can be concerning from an overall health perspective. We also see intake of energy dense foods, and oftentimes these foods are not often nutritiously dense, but they are more processed, higher calorie options that we see that are chosen. We can also see excessive micronutrient intake from dietary supplements rather than whole food sources, as well as food contaminants. And some outcomes that we can have an impact on, even in the prevention stage, is, making some new changes with nutrition can help us to improve patients' overall weight, as well as their body composition, helping with that muscle mass maintenance or helping us to rebuild some muscle. We can also look at improvements in blood glucose control, as well as immune health as well. Then once we are into the treatment course, when we see patients coming in beginning their treatments, we understand, if any of you have been through this or are currently going through treatment, we can see that there are all different nutrition concerns that can be associated with their treatment course. These can include, but are not limited to, fatigue, which was mentioned earlier, pain, decreased intake, muscle wasting, immune suppression, as well as weight or body composition changes, and specific drug nutrient interactions with certain foods or certain supplements that patients may be taking. And we can definitely have an impact here as well. Making a positive nutrition change during this treatment time can help our patients to be able to stay to their scheduled treatment. We understand how important this is for patients, not only to begin treatment on time, but to be able to stay on their schedule and not cause any unwanted delays due to some of those side effects or additional complications. So we do see that, as well as fewer infectious complications, improved body weight and composition, and these can altogether help us to delay or prevent disease progression and overall improve chances of survival, as well as quality of life for our patients. Then moving into survivorship, we do still see some of those same concerns that we oftentimes see during the treatment course. You may see that lingering fatigue, maybe ongoing pain. We also see some newer concerns that may creep up, including endocrine, blood glucose control, issues with weight loss or changes in body composition as a result of treatment or surgery. We also see that decreased bone density in a lot of our patients, as well as cardiovascular complications and potential cognitive issues as well. And even into survivorship or living with cancer, we can definitely make a change nutritionally to help us with our outcomes. Outcomes of nutrition interventions into survivorship can include decreased fatigue, improved overall function status, more rapid recovery from treatment, improved weight and body composition, and we've seen that quite a bit throughout the course of our journey, decreased risk for recurrence and subsequent primary cancers, improved chances of survival, and improved quality of life. And so now talking about how we get started. So we understand that nutrition can be beneficial and it can have a positive impact at each stage. So what are some things that we can start to do? And I understand that many of us in the audience may be at all different points within the treatment process, maybe just after diagnosis, going through treatment, or into survivorship. So I wanted to include some considerations at each point in the journey. Oftentimes when I meet with my patients, prior to the start of their treatment, I do have some specific goals for them. And these are going to be, kind of at the top of our list as far as what are we going to address. I do try to help them address any weight or muscle mass loss that they may have experienced coming into their diagnosis. Nicole helped us outline, why that is so important to maintain muscle and achieving that healthy weight. So we do want to try and preserve as best we can any issues that you may be coming in with. Patients also may be experiencing, certain symptoms coming into treatment. They may have issues with digestion. They may have issues with, that early satiety or feeling full quite quickly after they eat, leading to decreased intake. And oftentimes my patients are following, specific dietary restrictions. Maybe the patient has some allergies or follows a specific diet for religious preferences. And so I do talk to them about how can we make sure to meet your needs, even with some of these parameters in place. And action items for patients, I usually have them try to outline a plan before going into treatment. How can we think about how we are going to optimize our nutrition going into treatment, maybe not feeling quite as well, maybe having some side effects? How are we going to prepare our pantry, our refrigerator to make sure that we are well stocked and well fed during those days? And I encourage patients to discuss their plans to obtain groceries or meal preparations, to think about, are you doing all the preparation for yourself at home? Do you have any support persons there? If you are doing a lot of your own meal preparation, it may be beneficial for you to maybe get some, freezer meals that you can stock and easily access. Or if going to the grocery store might be a difficulty for you during treatment, maybe trying a delivery service. Or I know a lot of my patients really appreciated having some of those deliveries like Instacart, all of those, to be able to get their groceries straight to their doorstep. So, and I also recommend that patients review their plan for groceries and meal preparation with their caregivers, with their support persons, to make sure that they do have adequate nutrition available to them with little to no preparation as needed. And my patients can always talk with me about their plans, and if we need to kind of put something in place, or if I need to refer them to community resources, we can address that at that time. And when we are in the midst of treatment, my goals for patients are that they maintain adequate daily energy intake. So making sure that my patients are getting enough overall calories, making sure they're getting adequate protein intake, as well as fluid intake. And oftentimes when I see my patients for the first time, I do assess their total needs and give them a little bit more of an individualized plan. But oftentimes that is something that your nutrition professional, your treatment team can help you outline. I also help patients to manage any new or worsening symptoms. These are all going to impact their ability to prepare and consume adequate nutrition. So if there is something that starts to creep in, we do need to address that, as soon as we can, so that way it doesn't, get into a worse issue where we see any concerns with hospitalizations and delay in treatment. So definitely, as a patient going through treatment, if you notice any new concerns, I would definitely recommend bringing it up to your treatment team, or if it is impacting your nutrition, to talk with your dietitian. And of course, the third goal is to continue following food safety guidance. We don't want to incorporate any unwanted sources of infection into our intake. So, making sure to bear in mind any issues with practicing food safety preparation and cooking. And we do have some resources available on that at the end of the slides. And when patients want to know, okay, I'm, working towards all of this, what else do I need to do? I usually let them know to try and prioritize their protein intake. Typically, we like to see adequate protein intake from dietary sources, animal or plant-based sources. If we do need to, we can go into the realm of oral supplementation, but I always recommend for patients, try as best you can to get that adequate protein from your diet. And try not to forget your fluids. It can be very easy to get dehydrated during the treatment course. So making sure that if you're not much of a water drinker, that you look at other ways that you can help to meet your fluid needs, or maybe ways that you can flavor your water, make it a little bit more appetizing to make sure that we are getting what we need. And if appetite is a concern, I often recommend for patients to try smaller, more frequent meals and snacks during the day, rather than eating their typical breakfast, lunch, and dinner, maybe splitting that up so we're eating every 2 to 4 hours during the day. So that way we can keep that digestion consistent, keep your intake consistent throughout the entire course of the day. And moving into survivorship, or once we are finished up with the treatment course, my goals for patients include nutrition to help recover and to help you heal. We want to see you regain your strength and getting back to a healthy weight, helping to manage any ongoing lingering side effects, oftentimes issues with, ongoing appetite concerns, taste changes, different things can definitely continue well beyond the end of your treatment. So we do want to make sure if we need to make nutrition adjustments there, that we are helping to support that. And our long-term goal is to reduce the risk of recurrence and other chronic health conditions. So we do want to keep that in the back of our mind to, help to support, our blood sugar health, our cardiac health, our bone health, all of these other things that also kind of pair into, pair nicely with the healthy nutrition that we'd like to see. And so our action items for patients moving into survivorship, I aim for patients to increase their intake of those plant-based high fiber foods. So we'll talk a little bit more about this on our next slide, but a diet that's going to be rich in a lot of these plant-based foods are going to help us with that prevention of recurrence, as well as maintaining good, healthy intake. And if you are a patient that has experienced any changes in weight or changes in body composition, where you do have a specific weight goal or you would like to rebuild some more muscle mass, it's important for patients to, so to speak, try to make peace with the scale. I understand that it can be difficult to monitor weight and track weight consistently, but it helps us to get more data and to have you and allow you to better understand where your weight currently trends. And by tracking your weight, maybe even once a week, you'll get a good idea of kind of where your range is. And then as you begin to make some of these nutrition changes or activity changes, you'll be able to see and kind of monitor your progress that way. And I wanted to share this little infographic from the American Institute for Cancer Research. It is their blueprint to beating cancer, and it is prevention as well as survivorship recommendations that can help us to really guide our recommendations as far as, what do we need to do moving forward? What are some things that we can do from both a nutrition and a lifestyle perspective to help us to really meet some of these wellness goals? And as you can see on here, there are some nutrition pieces, such as increasing those plant-based foods, eating a diet rich in whole grains, vegetables, fruits, and beans, limiting our consumption of the red and processed meats, limiting consumption of sugar-sweetened beverages, and watching out for some of those fast foods and other processed foods that are higher in fat, starches, or sugars. You can also see we do, touch on weight as well as that physical activity component. So this is a really nice framework to kind of help to get us started with some of those changes. And I really like this infographic from the AICR website because it talks about how we take that blueprint and what are some ways that we can really put this into action. What are some ways that we can actually start to make these changes? The one item that I wanted to pull out here is this green box that I have my cursor on. And it mentions the new American plate. So I don't know if any of you are familiar with the food pyramid or have heard of, the updated version of the food pyramid, which is from the USDA. It's called My Plate. Well, the AICR actually took the My Plate model and they took it a step further. They formulated what's called the new American plate. So this is a framework, and it's really nice because they actually show the plate, but it's a framework showing, what can that increase in plant-based nutrition look like, and what are some of these, taking some of these recommendations, how can we make this into something that, all of our survivors or those seeking prevention, how does that look? So you can see the concept of our old American plate. You can see about a third of the plate has our red meat on it, as well as a third being a starchy vegetable along with another starchy vegetable, and a nice pat of butter there on our potatoes. But you can tell with the standard American plate, it does have a higher saturated fat content. There is more of a carbohydrate component there. We really want to try and take that framework and move it over to what we see in the new American plate. So how can we, mix and match, maybe do a few different types of vegetables? Can we incorporate some whole grains, some lean sources of protein, and even incorporating more plant-based sources of protein, like your beans, your legumes, your pseudo grains, those types of things. So it really helps to give a good example of kind of what we're working towards. And ACR's website provides a really great Healthy 10 challenge, which is something to kind of take all of these recommendations, and it really gives you a nice interactive guide to starting to make some of these changes. So it is a really great resource. If you have not had the opportunity to check it out, I would highly recommend it. And I did include their website on here as the third resource. The other two resources I wanted to share with the group tonight is our Eating Hints booklets from the National Cancer Institute. This is a really nice booklet. You can see a copy right here. This booklet's nice because it talks about nutrition interventions, during the treatment process as well as after. It provides some nice recipes, food lists in there, treatment based on different side effects, and you can request or order a physical copy, but there are digital PDF copies available on their website as well. So I would highly recommend going to download that. And then I also included the Leukemia Lymphoma Society. They do a really great job with looking at nutrition resources for patients. They do also have dietitians that are staffed within the society that do a lot of their different education materials, as well as new counseling initiatives and different things like that. So I would highly recommend checking out those resources. And I think that is it. That completes my portion here. Does anyone have any questions for me or any questions for Nicole?
I have a couple questions, Amanda.
Sure, absolutely.
Going back to that, I think it was the slide just before this one with the different, can you give an example where it says do not use supplements for cancer prevention? What would you suggest? What are some of those supplements?
Mm-hmm. Well, and it's more so looking at pulling out micronutrients from an oral supplement versus incorporating that as part of a whole food. So in looking at antioxidant support, vitamin C, vitamin E, how can we get that from a whole food source rather than taking it just as a pill or a tablet or a liquid? And obviously there's a time and a place for, oral supplements. And I always encourage patients to really work with their oncologist, their treatment team, their pharmacist to really look at, if there is a nutrition deficiency that can't be helped by incorporating more of those whole foods, is a supplement needed at that time. So does that help to?
Yes, exactly. And I did have one other question. It's kind of general. What do you suggest for taste changes? Like when you have whatever different types of medications and needs, water tastes different or certain foods taste different. Like if it's water, do you just recommend different flavoring packets, or are there other tricks of the trade perhaps?
That's a very good question. It depends on, kind of the types of taste changes that are going on. Generally speaking, I would say trying to maintain good oral care using oral rinses, like a baking soda and saltwater rinse can really help with, trying to cleanse out that palate a little bit. Oftentimes fruit and citrus flavors tend to do a little bit better for patients rather than, generalized sweet flavors. If patients are having, an increased or a heightened sense of sweet taste or salty taste, sometimes doing blander foods can sometimes be easier, because then that way you're not getting a heightened off taste. More so you're just kind of getting a blander option that's not quite as offensive. I would also say, as a general recommendation, if patients have issues with more of that metallic type taste, sometimes utilizing plastic or bamboo utensils can be helpful rather than using silverware.
Okay. Thank you.
You're welcome.
And I will definitely provide links to everybody for that were shared tonight. So I appreciate all of that, as well as the slide deck. This was great. Well, I thank you both. And if anybody has any questions that pop up after the fact, feel free to send them to me, and I can either connect you with Nicole and Amanda, or I can take your questions to them and run them back and forth, whatever works best for everybody. Happy to help any way possible. And we shared a lot of wonderful information. Again, we'll have the recording available later, so if you want to rewatch, that's available too. Thank you both very, very much. Really appreciate your time and sharing your wealth of information with us.
Thank you for having with us. Yeah, we really enjoyed it. I think Amanda and I both, it helped us bring some things together too, and some things that, patients have asked us to dive deeper into. So this was great.
It's a lot. Well, thank you all. Have a wonderful evening, and we'll talk again soon.
Thank you.
You're also.
Thank you.
Thank you. Bye-bye.
Bye.
Thanks.